Great. And also joining us are the three members of my team who run the NYCHA Health Corps program day to day. And so just quickly, if the three of you just want to quickly say your name and your roles here as well. We'll start with Elena.
Hi, everyone. My name is Elena Farmer, and I'm the manager of the NYCHA Health Corps. I'm also a 2-year AmeriCorps alum. Happy to see you. Turning it over to Michelle.
Good afternoon, everyone. Michelle Valise, and I am the program associate for the NYCHA Health Corps program, and I am a one-time only AmeriCorps alum. Pass it on to Kiara.
Hello, good afternoon, everyone. Kiara Sarin Agnew. I'm also at the NYCHA Health Corps. I'm also one of the associates here, and I am a 2-year alum.
Great. All right. Cool. Well, let's go ahead and get started then and talk about our NYCHA Health Corps AmeriCorps program. Great. So today we are going to go over the program. We're going to talk about each of our different partners who are on the call. Most of you probably know NYCHA, although maybe you don't know all that they do in terms of health initiatives. But we'll talk a little bit about NYC Service. We'll talk about Public Health AmeriCorps, which is the broader grant that gives us NYCHA Health Corps. We'll talk a little bit about, okay, fine, there's this program, but what do AmeriCorps members actually do? What is the type of impact that members have? And then, you're so interested and you're excited, we all hope, by the end of this. So what do you need to do in terms of checking on requirements in the process for applying to be part of the program? So in terms of partnerships, first of all, NYC Service, we hold the grant for this program. So we also run 4 other AmeriCorps programs, and I'll talk about those in just a minute. But NYC Service is a division of the mayor's office that's focused on volunteerism and service. And in 2009, at the height of the Great Recession, then President Obama called on the country to volunteer for each other in that time of great economic uncertainty. And our then mayor, Bloomberg, stood up and said, not only will New York City encourage folks to volunteer, but we'll do one better. We'll create the first ever chief service officer in a city and also create an entire municipal office around service and volunteerism. We were the first of its kind. There are now over 220 what are called cities of service across the country, but we were the first one. NYC Service from the beginning really has looked to build partnerships to deepen and expand volunteer opportunities and service programs. So we support nonprofits with their volunteerism programs. We do programming around youth development. We work with corporations on their corporate social volunteering programs. And then we help city agencies to increase their volunteerism as well. If there's benefits changes or things like that, we help recruit residents to help support those city agencies to get the word out. We also run 4 AmeriCorps programs. And our vision really is to unite New Yorkers to advance lifelong service for a more equitable and inclusive city. And really, we want to create sustainable change for our city's greatest needs through our programming. And so our 4 AmeriCorps programs, we started with one 14 years ago. I was part of the founding team here at NYC Service, and I remember very clearly when we started with one AmeriCorps program, and now we've grown to 4. All of them do slightly different things, but really, we place members, AmeriCorps members, AmeriCorps, the federal program that oversees national service for the country. We place members at about 60 nonprofits and city agencies throughout the 5 boroughs to both provide members with workforce skills and pathways to public sector and nonprofit careers. Members come to these programs. Some of them, we only have a high school diploma or its equivalent as our requirement, and you must be at least 18 years or older. And so some of our members are coming right out of college looking for that first job experience. Some of our members may have been out of the workforce for a while and really looking to re-engage, build new skills. People really see this as a place to develop skills. We also see this as addressing pressing local issues. So the reason why all of you are here, what are your pressing needs and challenges, specifically around health and public health engagement, and how can members support that? And then finally, creating opportunities for civic leadership development as well. And our vision for our programs is that every one of our host sites, both our nonprofits and our city agencies, are more effective and efficient because of the members who are serving at those host sites. I will turn it over to Andrea.
So, I mean, some folks on the call who maybe don't have as much interaction with us in the NYCHA Health Initiatives team may be wondering, how is it that a landlord, one of the nation's largest landlords, largest public housing authority, came to be part of this work? And part of the answer to that story is that we actually do have a whole team, a whole department that's really working across systems to build resident health and advance health equity. And, one of the ways that we do this work has been a bit of a focus on creating a pathway for NYCHA residents into preventive health careers and health equity and public health careers. So we frame this as our NYCHA HealthWorks initiative. And underneath that umbrella, we have a lot of different programs and partnerships. And you can see the names of some organizations. We even have CABS here, which I see someone from CABS is on, which is wonderful. They're a partner of the health department's Vaccine Equity Partnership Engagement Program. But we've partnered with a lot of groups across the city, both in terms of some place-based community health worker interventions and some training programs, again, creating pathways into these careers. And if we go on to the next slides, I think we just have a couple pictures of what this work can look like on the ground in the community. And the picture you see at the top is actually from a graduation ceremony from the very first program partnership that we were involved in that started about 9 years ago, called the Harlem Health Advocacy Partners Program with the Health Department, Dr. Mary Bassett, the health commissioner at the time in the picture there, along with a number of community members. And then we've got some pictures of teams working in the field, as well as someone working from home, right? As we have done during the pandemic, and some folks still do remotely from time to time. So we do have a number of partnerships in this area. We're looking to grow more, and this program is an incredible foundational piece of work that allows us to do that. And I'll kick it back to Erin.
Great. So I've mentioned the word AmeriCorps many times, and some of you may be familiar, but if you're not or need a refresher, AmeriCorps was signed into legislation actually in 1993, and is the federal agency that really oversees national service and volunteering. So here at the local level, NYC Service does that for the city of New York, but AmeriCorps is the federal agency that does that across the country. Most of their programming is the AmeriCorps program. So placing U.S. residents as AmeriCorps members at nonprofits and municipal agencies throughout the country. There are thousands of grantees who then place members with them. And there are about 250,000 active AmeriCorps members, and that's split into two groups. So about 65,000 AmeriCorps members who are serving 10 to 12 months of their time. And the balance of that are what are called AmeriCorps seniors, and those for our Americans 55 years and older who are volunteering and serving in their communities under three different programs. So what we're talking about are kind of the 65,000 who are placed, and of those 65,000, about 3,000 of those 65,000 are actually placed here in New York City. So a good chunk of those are placed here. You can see here every 2 years, AmeriCorps is also required to review volunteering throughout the country. And so this is the most recent report. It spans September 2020 to September 2021. So if you all remember that time period, kind of feels like yesterday in a weird way, but also sort of a long time ago. But that spans really the height of the pandemic. And so, but even in that period of time here in New York, 3.3 million people volunteered through an organization. And as you can see, volunteers contribute, they more than double actually their contribution. So 3.3 million residents, actually that's more than double. I read that as million instead of billion, contributed $7.2 billion in economic value through their volunteering. So, you know, a lot of good things here happening in the city, but AmeriCorps members are really unique resources provided to organizations or agencies to really provide, to add capacity and build capacity and add value. You're going to hear me say that a couple times today. Build capacity and add value. So, are there populations that you want to seek but haven't yet? Is there programming that you want to deepen? Is there something that you've always wanted to kind of build and build out? AmeriCorps members are really suited to do those sorts of things during their term of service. And so NYC Service, as I mentioned, since 2009, we've grown from one AmeriCorps program to 4. And over 2,400 people have served through our programs. And in fact, we are doing our first ever longitudinal study right now from 2009 until 2022 of all of our alums to see how their skill development was impacted, the impact they felt like they made on the community during their service, and their educational and civic engagement impacts because of their term of service. So really excited in the coming months to share out kind of what we've learned from that. But members really gain valuable leadership and work experience. And part of that is members receive approximately 200 hours worth of training. That includes a 65 or so hour orientation. But we train members on things like project planning and management, data collection and management, leading effective meetings. We do a really good training with the Office of Administrative Trials and Hearings on giving and receiving feedback using mediation principles. We do a half day on diversity, equity, and inclusion and why that's important, and how to incorporate that into your practices in your service. And things like leadership style as well. We really value the member experience, but we also know that most of the training they're going to get, in addition to some of the health related training that we give our members as well, most of that training that members are going to get is on the ground at their host sites as well. So we recognize that as well. Next slide. So here's our 4 programs. Not going to go into great detail about all of them, except of course our NYCHA Health Corps, which we're here to talk about today. But basically we have our City Service Corps program that places members at city agencies, really doing a lot of outreach and program management. We have our NYC Civic Corps program, which places members at nonprofits to help them with volunteer programs. So anything from recruitment, training, strategy, evaluation, management of volunteers. That's what our Civic Corps members do. Our NYC Vista program places members at city agencies to work on anti-poverty programming. And finally, our NYCHA Health Corps. And NYCHA Health Corps is currently in our inaugural year. We launched our first program cohort in late October of 2022. And what is unique about our program, and Andrea is going to talk about this during her section in just a minute, is we are really recruiting NYCHA residents to serve our NYCHA communities throughout the city, specifically around public health related direct service and capacity building. So here's a little bit of impact that our members in 2022 had. You'll notice NYCHA Health Corps' logo is missing on here because they hadn't started as a program yet. But we just show this to say we had a little over 100 members last year, and they served over 81,000 New Yorkers. and made 38,000 of those New Yorkers more aware of city services because of their service. And 90% of our host sites said that their projects were more efficient because of their members. So really what this shows is, you know, a little over 100 members, and you can see these numbers. They are able through their term of service to make a huge impact in what they're doing. And I expect, you know, similar numbers this year, especially from our NYCHA Health Corps members. They're doing some really exciting things on the ground as well. So now let's dig in a little bit to the NYCHA Health Corps program. So just a little bit of background. In 2021, as part of the American Rescue Plan Act passed by Congress, it was President Biden's first big bill that he passed once he became president. If you'll recall, a bunch of that bill was around COVID spending. But one of the things in there was to create, in a partnership with AmeriCorps and the Center and the CDC, the Centers for Disease Control and Prevention, to create a new public health AmeriCorps funding stream to support the next generation of public health leaders. And so NYC Service, when we saw this grant opportunity, we saw it and we said, we really feel like New York City should be a part of this. We really feel like, you know, we have one of the preeminent health departments in the country. A lot of great work around public health is happening here, but there's also a lot of need here as well. And so when we saw the opportunity, we turned to our partners at NYCHA, because we thought, what a great partnership. And they came on as our lead partner. And so really excited to, you know, there are hundreds of sites across the country. We are one of the largest localized sites. There's a lot of organizations that have places in multiple cities or multiple states, but we are one of the larger grants just in one specific city. But really excited to go into year 2 and have some great partnerships and great positions for our members to do through their service to help advance public health. And so with that, I'm going to turn it over to Andrea to talk a little bit more about the program in particular.
Thanks, Erin. So yeah, I mean, as you can imagine, this is a program that's working across systems. So of course, 2 goals is better than 1. So the 2 goals that the program is really seeking to work towards is to make sure that we're finding new ways to support drawing partner investment into preventive health work across NYCHA communities. That's really working to build health equity in and around public housing communities in New York City. And then the other goal is to make sure that we are just, again, creating pathways, creating opportunities for NYCHA residents that are interested into entering or deepening their work in public health careers to do so. Next slide, please. And so, you know, there's 3 sort of groupings of interventions that the Health Corps members can and will be doing and are doing across NYCHA communities. One of them is an individual level intervention. Obviously, this can take many forms depending on the type of health work that it's related to, but we have a few examples here. Definitely, you've got your peer support that could be something related to mental health or some other areas of health, helping people navigate and access resources, or possibly some sort of one-on-one health coaching model, which I know there's some folks on the call that are involved in. So you've got the individual support, and then you've got the opportunity to have core members contribute to a group activity, engagement of community members into health activities, and also helping to coordinate and lead group wellness activities. So you've got a few different examples here, or a description of the example here, some sort of activity that's supporting a health-centered aim. That could be some sort of health fair activity or consistent programming that's happening at a location. And the third bucket that we have listed is thinking about how do we activate open space and how do we maybe drive research that's going to promote health and health equity across NYCHA communities. And advance and support NYCHA resident health and well-being. Next slide, please. So we have here a listing of the actual roles that this year's first group of NYCHA Health Corps members have performed. Some of them are actually on our team at the NYCHA Resident Health Initiative, including someone who's working on our smoke-free project and a few other specific projects that we have. We have a number of Corps members that are serving at the health department in different roles and capacities, including some that are working on maternal health and other peer community health work. And we've got, another grouping that are with health and hospitals, working for SCAN, right? A place-based, community-based organization. Phoenix House that works across a pretty large geography in New York City, and a number of other citywide and local groups that we see listed here. Each of these organizations, including the public sector, as well as the nonprofit sector partners, completes a partnership agreement that formalizes their ability to serve as a host site prior to having the Corps members start. Next slide, please. And I think that photo there is at a volunteer event that Corps members were working. Okay, so lots of benefits to discuss in the upcoming slides. I think the first framing is, what is the benefit to you as a host site? And I can speak to this as a partner on the program, but also as a host site. We ourselves are a host site. So I think Erin said it before, right? Building capacity, that's kind of the tag phrase for the day, but definitely new initiatives that you're growing, emerging projects, lots of ways that Corps members can contribute to that. Obviously, you also have Corps members, themselves who are NYCHA residents coming from NYCHA communities, whether they are public housing residents or Section 8 recipients. And there is tremendous value that they bring to the work as a result of having that direct understanding, right? Personal experience, cultural competency, living and working, contributing in communities across the city. Some examples of functions they can perform at the host site for you and your team. Again, community engagement, helping to develop projects, actually implementing projects and providing other strategic support to you and your team members. They definitely can and do bring fresh ideas and creativity. I've seen it happen on our own team to, again, existing programs or new programs that you may be seeking to develop. And, also really help you expand your organization's reach, right? Maybe get to a new area or a new subject area that you haven't had the bandwidth or ability to work on. And of course, we're also hoping that there is the possibility here that this may be creating a talent pipeline that may result in actual talent that could be brought onto your team somewhere that down the line in terms of a more employment-based opportunity post-service. So talent pipeline is definitely another potential benefit. Next slide, please. We've got a few quotes here. I don't know how big folks' screens are today. But different quotes from Corps members. I'll allow you read them, talking about the benefits of working in community and the impacts that they're able to feel and see of reaching residents, and just the importance that Corps members have in terms of building trust when they are serving communities that they are also from, as they're building health and health equity. And the second quote relates to someone who was really excited to also be able to create and help lead a training for residents, and sort of the ability to have a blank canvas and help co-create or create something that they were then involved in rolling out. Next slide. And we've got lots of quotes from supervisors, although we're looking at another dynamic photo of Corps members actually in a training session that we had a few months back. So supervisors saying, how helpful the Corps members have been in helping to plan and execute activities and really deepen the reach in the community. Next slide, please. Okay. So I think, there are many different types of host sites that can be amazing host sites, but we are looking specifically for either a public agency, public sector, or nonprofit sector. And we're looking for organizations that do partner currently with NYCHA, or, maybe don't have a formal NYCHA partnership, but are substantially in your work serving NYCHA residents through work that also has that direct service and capacity building aspect to it. We absolutely are looking for organizations that have supervisors that are really well positioned to serve as coaches and mentors, and we'll really prioritize that as part of the work that they do in supervising core members. There will be orientation that happens for supervisors prior to the start of the program, and additional training sessions for supervisors throughout the course of the program year. Next slide.
All right. Michelle, can we just go back one slide? I just want to say couple things as you're looking to apply. There are some restrictions around what AmeriCorps members can and cannot do. So make sure on our website we kind of have a link to those, but really, and it's in the application as well. But really, we want to make sure that we're staying within federal rules and regulations. So the ones, there's only one that's health related. Both parties of Congress had to come together to pass AmeriCorps legislation in the early 90s. And so there is a restriction around abortion and abortion education and services. Other than that, they fall really under political work, working with religious organizations. If you're a faith-based 501c3, so long as you're not doing religious education and religious work through that, most often members can be placed there. And then there's prohibitions around for business or for profit companies. Members can be placed at nonprofits and at municipal organizations only. Okay, so I just wanted to add those things. Next slide. Okay, so in terms of our members, so you've learned a little bit about what the members can do at your organizations, and some of the requirements for all of you, but who are the folks who serve in our program? So again, our members, we recruit our members from the NYCHA community, and they do receive a living stipend. So members are not paid a wage. They receive a service stipend for their term of service, which is 10 months, 10 months, give or take a little bit. And they also receive, if they successfully complete the program, a federal education award. They can use that either to put pay back student loans or to put towards future schooling. And they define future schooling very broadly, I'm happy to say. So it's not just a four-year institution or community college, but also a lot of trade schools, certain kind of certification programs. Members can find broad array to use those. In fact, we get the printout every year, and somebody used theirs to go to tattoo school. So wide variety of where they can use that. They also will receive a monthly unlimited Metro card at least through the end of December. As you know, the Omni card, the Metro card goes away at the end of the year. So we're still trying to figure out what the transportation benefit looks like after January 1st. AmeriCorps also has healthcare and childcare assistance. They can have student loans. Qualified student loans can be deferred during their term of service. And then if they complete their term of service, they can have the interest that was gathered up during their term of service. They can have that repaid by AmeriCorps, the interest, not everything else. And again, they also receive professional learning development, including this year, one of the exciting things from New York State was they created a partnership with Cornell University for our members to receive the Public Health Essentials course. It's a $3,600 value that only we pay it out of our grant at a much discounted rate from that. but that's something members can take and put on their resume and show to folks that, hey, I completed this public health essentials certification program. As well as members receive career coaching, access to networks, and other service days and leadership opportunities throughout their term of service. So your members at your host site, they are full-time in service. So they're expected to serve an average of 30 to 35 hours per week, and to work on specified tasks and projects. In a position description, we have a template that you will find on our website in terms of that position description. Members participate in all of our trainings and comply with all program rules and policies, including any program policies and rules at the host site as well. And just a reminder here at the end, members cannot displace an employee or volunteer. Members are really there, again, hopefully you all remember my two phrases: build capacity and add value. Next slide. Okay, so hopefully you're all excited and you're like, yes, I'm excited. I want to apply. Where can I sign up? Here you are. So application materials can be found at our website, nyc.gov/serve-NYC. That takes you directly to the AmeriCorps page. Just click on NYCHA Health Corps. There are several programs that are on there. So find NYCHA Health Corps and click on there. You are going to, there's a bunch of information. We're not gonna sugarcoat it. There's a bunch of information there. It's all really important information to read through. There's position descriptions. There's like how to fill out a position description. You may be like, oh, I know how to do this. Just give it a look. We want to make sure that the member service lasts through the whole term service. And so there's a specific way to fill that out. And then if you are a nonprofit, there are a couple of other things that we need from you as well when you submit. If you're a municipal agency, some of those things don't apply to you. Then we will review everybody who has applied and score with a rubric. And then we also will do supervisor interviews. So we want to speak to the people who are going to be directly managing those members. So not the person who filled out the application, although if they are one and the same, that's fine. But we want to talk to the people who will be managing the members during the year. That way we can understand a little bit more about their management style, a little bit more about their, why they're bringing on a member in this position, and just so we can learn a little bit more about the culture of the organization, really because we want to make sure that it's a good fit for members. The supervisor relationship with the member is the most important relationship during their term of service, not with us, not with our lead partners at NYCHA, but with the supervisor on the ground. And so we want to make sure that we talk to them as well. So we will make a decision then. If you are selected, we may select all of your positions. We may select a partial number of your positions. We only have a certain number of slots, but we also want to make sure that all of our positions meet all of the AmeriCorps expectations as well. And then moving forward, we will have trainings on recruiting and onboarding your member, as well as how to manage a member over the course of the spring and the summer. All right, and so here's the timeline. The application launched a week from today. Launched a week ago, not a week from, a week ago as of today. You are attending one of our info sessions. The application does close on April 14th. That is a hard deadline. We have to have our members selected by a certain date because the AmeriCorps background check, members do go through a criminal background check as part of the AmeriCorps requirements. We need several weeks of time to do their background check, as well as having AmeriCorps verify their employment verification. So kind of backing up our schedule, we have to have all of our applications in by the 14th so we can make decisions and then get member recruitment started, because we need a couple of months for member recruitment as well. So please, 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 if you're the type of person to wait till the last moment, this is not the time to wait till the last moment. This application is not short. So, open it up, start working on it a little bit today, or whenever you have time in the next few weeks. But please remember, April 14th, end of business. That is when it will close. And with that, we're gonna turn it over for questions in just a minute. But if you do have any questions, you can email both the NYCHA Health Corps email address is there, or the Health Initiatives email at NYCHA. If you have specific questions about the application and the application process, you really want to address those to the NYCHA Health Corps at City Hall email address. If you have other generalized questions about the program, you can email both partners, but really application stuff, feel free to send those to our team because we are the ones running the application. And Elena just put those in the chat box as well. All right, and with that, do we have any questions in the chat box, or does anybody want to come off of mute? If you have any questions, and feel free to ask them.
Hi, good afternoon, everyone. This is Belinda from CABS. Hello. Thank
Hi,
you,
Belinda.
Belinda, good afternoon.
Hi. Thank you so much for the presentation and just presenting this opportunity, which we are interested in. As mentioned earlier by Andrea, we do already work with NYCHA and the department, and we would want to deepen that relationship. A lot of our staff and clients are also residents of NYCHA, so we love to keep our hands really into the community. I have a question about how this would work for us or any other organization, and it's possible that you answered it earlier on, but we're looking at capacity building. Oftentimes with programs like this, the capacity required to even get the program going